Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Let's look at the Flial chest. So by definition, it occurs when a segment of the chest wall, it lacks the bony continuity. So there is no bony continuity and with the rest of the thoracic cage, The causes is the fracture of two or more consecutive ribs. So two or more consecutive ribs and more places as per the ATLS 10th edition. So it is often associated with the pulmonary contusion. The clinical features, it includes a paradoxical respiration and the fracture segment moves opposite to the rest of the chest during breathing. So fracture will move opposite to the rest of the chest. The voluntary splinting is due to the pain increase. So there is a voluntary splinting. So this voluntary splinting is due to the pain which increases the risk of respiratory failure. So what is the investigation of the Flial chest? The investigation is, there is a diagnosis is primary clinical and observe the patients for a paradoxical chest wall motion. Ask the patient to cough or observe the chest cavity movement. So how do you treat this? The treatment is by administering the oxygen. So administered oxygen and provide the adequate analgesia. So adequate analgesia and including the epidural analgesia, So next is you also utilize the physiotherapy. In case of the Flial chest, the respiration, consider the intermittent positive pressure ventilation. So it is a IPPV. And in case IPPV fail, you go for the surgical correction, which can be done. To learn and grow daily like this, please do subscribe.